My name is Dr. Sherif El Wakil. I'm a cosmetic and sexual aesthetic doctor. I work in my clinic, Dr. SW Clinics, in 77 Harley Street, London, UK. The P shot is coming from a priapus shot, and it's basically a PRP injection into the penis. PRP stands for platelet-rich plasma. Let's say in our blood, there is a plasma, which is the water that every other content or component of blood runs into it. So the red blood cells, the white blood cells, and the platelet. So what we do is we take a sample from the patient's arm and then centrifuge it in a very specific centrifuge to concentrate the platelet. And these are the platelet that we take then in the sample. That's why it's called platelet-rich plasma. So it's plasma rich in platelet. And then we inject that back into the penis in a specific way and a specific protocol. Why do we do that? Because patient tells me, for example, well, I have the blood already in my penis. Why should I just take it and put it back in the penis? That's a very, very good question. But the idea is I'm concentrating this amount of platelet. But why platelet? I will give you a very simple example. Let's say you have a cut in your hand, for example, like this, right? It's a big wound. And 3 weeks later, you look at your hand and then it's complete skin again. Nothing showed, the wound is gone, everything is fantastic. So what healed that? This is the platelet. So the first line of defense for this cut is the platelet. These are the ambulance that come to the area. If you see an American movie, you see the SWAT cars. Yeah, the SWAT team. That's the SWAT team that comes into the area, and the back of the car opens up, releasing the SWAT soldiers. They're wearing black. These are called growth factors. They come from the platelet, and the growth factors come into the area and hug each other. So if you want to see these growth factors, they create something called fibrinogen mesh. If you want to see this fibrinogen mesh, do you remember when you were a child and you fell down, you have this crust or scabs in your elbow, and you're trying to see what is actually attaching this crust to my body, and you see this yellow glue in your body? That's exactly the fibrinogen mesh that the platelet create. Once this fibrinogen mesh is created, then it attracts the stem cell in your body to come and create the new skin. So the stem cell is the raw material that creates everything in your body. This is regenerate your liver, it regenerates your lung, it regenerates your muscle, it regenerates your ligament, your bone, anything. So the fibrinogen mesh creates the platform for the stem cell to come and create this new skin. So the same concept, we took it and we are now doing it on the penis. So when I inject these platelets, I trick the penis, making it feel that there is a wound inside, because I do something called activation. So I activate the platelets, so they open up and they feel, oh, there's an injury here. They come all over the penile muscle and start regenerating the muscle, regenerating the blood vessels, regenerating the nerve endings. And this is how we are regenerating this vital organ. Very good question. Thank you for that. It's very important to understand that a lot of people think that the PRP is, I take some blood, put it into a spinning device, I bring something yellow and I inject it into the penis. But I have about 14 centrifuge in my clinic, 14 or maybe 15. And I discovered after so many years of doing PRP that actually not all PRP are the same. So finally, the device that I use is extremely expensive device. And the kit that I use for each patient is extremely expensive kit. But why do I choose to do that? As opposed to a machine that probably the company give it to you for free, and the kits are extremely cheap, and they get you this yellow stuff that you inject into the penis, and that's it, or in the face or whatever. Because the quality of PRP is very different from one device to another. in order to have a therapeutic effect, you need to have at least 4 to 6 times baseline, which is almost 4 to 6 times concentration of the amount of platelet that's normally in your body. And most of the machines in the market give you about 1.5, maybe 2 maximum. If you have 2 concentration, you're not going to really reach this efficacy that you want, especially when you are treating sexual organs. Maybe for the face, you can see a little bit of glow. Maybe for the hair, you can see a little bit of a grow in the hair. But for this, you need a very highly concentrated amount of platelet. And that's why the machine that I use, and even all the doctors that I trained, I always advise them to use a very high-end machine in the market that gives them the highest amount of concentration, so the patient can get the best result out of this treatment. So to the patient looking for such treatment, please don't seek cheap options, because cheap options are not going to give you the result that you want. And you're going to keep repeating in order to get any sort of result, but you probably won't. So this is part one. Part two, you really need to look for somebody who has experience in this procedure, who has done it so many times. Check his reviews, check the testimonials on YouTube, for example, or you know, his website, because it's very important. That's a very important part in men's body, and you don't want to mess with it. So it's very important to make sure that you're going to the right person. And I've trained good doctors as well, so they are able to do it. I want to explain something to you, if you don't mind. I want to use some illustration here. So let me explain to you how does erection happen. Okay, let me just adjust that for a bit. So first, the man get excited. He sees his girlfriend or partner or wife, and he gets excited. So this sends an impulse to the muscle here in the penis to relax. The muscle relaxes. Okay. Once the muscle relaxes, a gush of blood comes from the arteries into this muscle to fill this spongy muscle. Once this spongy muscle is filled, erection is created. And once erection is created, there are veins in here that, because the erection is so hard, actually the veins are closed passively. And eventually the blood is trapped inside the penis. Once the blood is trapped inside the penis, you have good erection. Then you go through the intercourse procedure. Once you reach orgasm, the penis relaxes, allowing the blood to go back into the vein that opened now, and you reach a full relaxation. So this is the mechanism of erection. Any problem in that causes a problem in erection, right? So for example, this muscle is not relaxing fully as it used to be. So why? A lot of things: diabetes, high cholesterol, aging, normal aging, antihypertensive medication, smoking, excessive drinking, a lot of things, right? So when it doesn't relax fully, it's not taking a lot of blood flow into the muscle, and as a result of that, it doesn't reach a full relaxation. Number two, the blood vessels are not gushing enough blood into the penis. Why? High cholesterol, excessive smoking, aging, antihypertensive drug, a lot of things, diabetes, of course, because it directly affects the blood vessels. So not enough blood flow going inside the penis, meaning that it's not going to have enough blood to fill this spongy muscle to reach the erection. Another very important reason why patients have a problem in their erection is actually the lack of sensitivity that developed on the shaft over time. And this is extremely important point that I would like to say. So for example, when patients are young, when they're masturbating, you instantly have a massive erection, right? But over time, they find that while they're masturbating, they require a lot of time and friction, and in order for them to reach the same amount of erection, because the sensitivity has gone down. This could be due to various reasons, but mainly aging. The sensitivity with aging is reduced, but the diabetes has a very, very, very important effect, or very dramatic effect on the nerve ending. So the sensitivity is reduced even more, and a lot of other reasons. So how does that affect erection? Well, you could actually reach erection. Let's say you reached erection. Then now you are introducing the penis into a vagina. The vagina is not as tight as your hand while you are masturbating. So it's soft and it's velvet, and it's not having enough friction during the intercourse, especially that the sensitivity is down already. So what happened is you start, or the patient start with erection, he start going into the intercourse. After some time, is not getting enough stimulation to maintain that erection, and eventually what happened is he loses the erection. And I'll tell you about a very, very incredible scenario. A man loves his wife or loves his partner very, very much, and they both enjoy sex so much, and they love each other. Then they start to have sex. His sensitivity is reduced, and she has a little bit of laxity in the vagina because she has babies now, and hormonal changes and aging and so on. So what happened is he starts with erection. He goes inside the vagina. The vagina is now lax. His sensitivity is reduced. He's not having enough friction. He does not maintain his erection, and then his erection starts to go down. Now he pulls out. Now there's two different scenarios going on. Okay, the first scenario and the man. Oh my God, what's happening to me? Oh, I'm not a man anymore. This is incredible. It never happened to me before. Oh, I feel so. What is she talking about me now? What is she thinking about me? I don't feel man in front of her. That's the first scenario. The second scenario that goes inside the woman's head. Oh my God, I'm not attractive anymore. He doesn't like me anymore. I know he loves Sarah. I saw him, how he looks to Sarah. Exactly, right? And you know, he's attracted to her. He's not attracted to me. It's a two different scenario. She'd never think that actually he could have a problem in reducing the sensitivity. Never. No. She thinks completely different story. And eventually, what happened is he tried to avoid being in this situation, and she tried to avoid feeling rejected, but because she feels rejected as well. So they avoid having the relationship, and slowly they become brother and sister. And you see this so many times, and they actually love each other so much, but they just needed to seek help to fix the problem. It's a very simple problem to fix. I could very easily increase the sensitivity on his penis, and I could very easily improve the laxity in the woman's vagina. All non-surgical, all 20 minutes procedure, and she could have fantastic result, and he will have fantastic result. So you see how the effect now has created this massive dominoes effect in the whole relationship. So so this is the with the P shot. Now back to the question, how does the P shot affect that? So the P shot regenerate the muscles, so the muscle could fill much better. The P shot regenerate the blood vessels, so you can have a much more blood flow, and the P shot, most importantly, can regenerate the nerve endings. And when you regenerate the nerve endings, then what happens? You have higher sensitivity. And we have something called vampire breast lift, and it's also injecting the same PRP but around the breast. And one of the main indication for that is women who actually have breast surgery, or they had a long breastfeeding. They lose the sensitivity in the breast. So you know, they do have a breast surgery, they have an implant, they have a very good looking breast, but they don't feel that much. A lot of them don't feel that much. So when they come to me, I do the vampire breast lift, I regain the sensitivity and there's quite a lot of testimonial in my YouTube channel to talk about that. And then the sensitivity is regained. So the same concept happens with the penis as well. To be honest, I've done probably 25,000 cases so far, and I haven't seen any side effects. There's no one single side effects reported so far. I mean, worst case scenario, it's not going to give him the result that he wants. But this usually happens when there is a much more severe causes of the long-standing diabetes for 20, 30 years, a lot of other issues. And that's why I created something called the O concept protocol. And the O concept is an umbrella of treatment. It's not just the P shot. It is so many other treatments. So now I have about 60 different other treatments under the umbrella of O concept, all to treat the erectile dysfunction. And then there's so many other treatment that we need hours and hours to speak about it. But each one of them actually is made to tackle one issue of the reasons of the erectile dysfunction, and eventually you manage to create a comprehensive approach to treat all the aspects of it. To be honest, any man can have this treatment. Any man can have this treatment. I have men aging from 20-something all the way to 94 years old. So it's basically regenerative. When you are talking about vampire facelift and injecting PRP into your face to regenerate your face, that's exactly what happens. You're just regenerating your penis. So it is something that could be done for maintaining your penile power and performance and everything, and just to rejuvenating the muscle. So it's apart from the people who actually need it, you can just take it to maintain your power and your stamina. So what happens in the day of the procedure? Usually the patient come for a consultation, and I have so many questionnaires, and sometimes they get really overwhelmed by the amount of questions that I ask. But it's extremely important for me to understand each case individually, because each case individually I tailor make the treatment based on them, which is the O concept treatment that I do. And then if the patient wants to have the procedure on the same day, then he goes into the room with one of my team, and then the area gets numbed. They take the blood, they put it into a very specific centrifuge, as I said. Then we take the centrifuge, then we do the injections. Usually it's not painful at all. I have patients who actually sleep during the procedure, and I have patients that feel that a little bit of discomfort. But the idea, of course, of needle going inside a penis is a bit like, wow, but they honestly don't feel anything because the cream that I use is very strong. So from start, when he comes to finish, it's probably going to take about an hour. But the actual procedure, it takes about probably 7 minutes to inject. But from sitting on the bed until he's finished is about maybe 25-30 minutes. Almost all my patients ask me that question, but I want to tell you that this is, as I said, it's a maintaining. When we manage to finish this initial hurdle, and we manage this initial hurdle and getting the flow back again, and the blood flow back again, and the muscle reaction back again, and the sensitivity up again, I need to maintain that. So I always tell the patient, when you go to a dentist and you tell him, okay, I need you to fix my tooth, he fixes it and he tells you what? That's it. I'm never going to see you again. It's finished. For the rest of your life, this tooth is perfect. It never happens, right? Because what happened to us as human beings, we go through degeneration process. And what I do is something called regenerative and functional medicine. I regenerate. So what happened after he reached this result? Sometimes due to the degeneration process, it starts to go down. Then he needs to come and we have one more top up, and then starts to go up again. So I always tell them that you need to maintain that. Some patient could have this every 2 years. Some patient could have it every year. Some patient could have it every 3 years. Actually, he will understand. So I get now emails from all my patients to my team say, hello, I need my top up now. Yeah, I feel I'm going a little bit down, so I need my top up now. Yes, actually, I introduced it about 10 years ago now. The guy who invented this procedure, a very good friend of mine called Dr. Charles Runnels, who also invented the vampire facelift. And you do need a special license to use it. Number one, the license actually makes sure that you had the proper training to do this treatment. So that's very important to check the website and make sure that he had this license to use that. So once I train a doctor, for example, then I gave him the license to be able to use and promote the word P-shot in his website and so on. And this is just to protect the patient mainly, because when the patient knows that, okay, this gentleman had, or this doctor had this a license, that means that he has properly trained. So I'm able to have the treatment with him.